Well, I think there's several groups of patients that I'll use ReSure Sealant on in terms of the clear cornea cataract surgery patient. The first one is the premium IOL patients, especially, for example, the crystal lens. You really don't want to have any leakage of your wounds. You really want to make sure that that anterior chamber is nice and deep and solid. I think it's pretty well known that you really want that for an excellent result. So that's kind of the typical classic one that I'll use it for. And if I'm going to be using it for the crystal lens, you know, I might as well use it for the other premium IOLs. I don't want to have any issues with potential for not only movement of the implant lens from a small micro leak that's going to be probably self-sealing. I also don't want to have any issues such as an infection, which is obviously would be devastating for these types of patients. As far as other issues, anytime I feel a little bit unsure about the incision, you know, I have no hesitation in terms of using the ReSure Sealant to make sure that I can sleep well at night, you know, because of the confidence that I have in the sealant. So as far as the future and as far as my experience with how adoption has been with the ReSure Sealant, I think it's actually been very nice as far as our division. So we do approximately 3,000 cataracts a year. And actually the first person to adopt the ReSure Sealant was actually the senior ophthalmologist. The senior ophthalmologist, by habit, had always put in a 10-0 nylon at the conclusion of his clear cornea cataract surgery case. And after learning about ReSure Sealant, after getting it through our system, and finding out that ReSure Sealant was superior to a 10-0 nylon suture at the conclusion of a clear cataract surgery, he started using it routinely. Number two is obviously the younger physicians also have adopted ReSure Sealant for two interesting reasons. Number one is usually the younger physicians are looking for better ways of trying to handle kind of the common problems. And this is obviously a very unique procedure. It's a very unique way to close that cataract surgery incision. The other fact is that the newer, younger physicians actually have not really been trained as well in putting 10-0 nylon sutures in. So for them, it's a much faster procedure, much easier. And again, they are very confident that their incision is going to be healed and well maintained. So in terms of the ReSure Sealant in our division, it's really been well accepted in terms of its adoption.